안녕하십니까, 김경원입니다.
Greetings, I'm Dr. Kim Kyung-won. Today I'm going to look at the different bone graft materials used in sinus grafts. I'm going to talk about my clinical experience rather than focusing on theoretical aspect and look at the bone graft materials. Recently, there are many studies that say that in doing sinus lift and doing bone graft, you can use whatever graft material. I've provided implant surgery as of 1995 after I served the military, so I've been using bone graft materials for approximately 27-28 years. And today I'm going to talk about my thoughts on what bone graft materials to use in surgeries.
말씀드리도록 하겠습니다.
First is autogenous bone graft. In 1990s, there was no clinical photo. Within the sinus, I did iliac bone graft. At the time, in the 90s, people thought that autogenous bone was the best, and to do extensive bone graft within the sinus, systemic anesthesia was done. In the right side of upper posterior, there is a tooth missing. The image is panoramic image. Because it's analog days, the image is not really clear. Medical CT was taken, and you can see there's not that many alveolar bone left within the sinus. On the right, there's no tooth, and on the left side, there's a single tooth remaining. However, I did iliac bone graft on both sides because implant placement may be necessary in the future. This is 3 months after surgery. On the panoramic image, because it's from the old days, you cannot really see it clearly. Below the sinus cavity, iliac bone was used for autogenous bone graft. Lateral window was done, and I put it in the hinge, and you can see that it is within the sinus cavity. Compared with the iliac bone, cortical bone is very hard. There's a stark difference in terms of bone density between iliac bone and cortical bone. Surgery was done in 1990s. In the upper posterior, 2 teeth were missing and 3 implants were placed. Looking at it from now, it doesn't look like a job well done. However, you can see that the 3 implants are maintained nicely even after 8 years. Iliac bone graft is not used quite commonly, and the prognosis was not very good too. The next autogenous bone graft was taken from the ramus of the mandible. As you can see, allogenic bone graft material along with autogenous bone was used. In 2009, when the patient first came in, both sides of the upper posterior were missing. Through medical CT, I found that there was no major issue within the sinus cavity, and because there was very little residual alveolar bone, I placed the implant in number 4 first. Sinus cavity was quite narrow. Sinus membrane is partially torn. If you look at the lower right image, as implant was placed in the lower, on the ramus side, autogenous bone was collected. Trephine burr was used. I particulated it. So I crushed the bone and mixed it with a SureOss allogenic bone. The ratio was 1:1. This was how the case was completed. Sinus membrane was partially perforated. Fibrin glue was used to repair it. This is immediate post-op, and the final image is approximately 7 years, 8 months after. On the sinus floor side, bone graft was done. In immediate post-op image, a lot of bone graft can be observed, the ramal bone and the allogenic bone. So it's been approximately 7-8 years. Compared to the dome shape we observed initially, there's a lot of resorption and remodeling occurred. If you use a ramal bone and allogenic bone together, remodeling can occur. These days, patients are more used to panoramic images, so patients ask. In the past, a lot of bone graft was done, but there's very little bone left. But you can see that remodeling has occurred nicely. Next, I'm going to show you a case where I used autogenous bone with xenograft. In 2006, a patient came in. In the upper left posterior area, teeth were missing. After extraction, I waited approximately 2 months and I used the lateral approach to form the window. I lifted the membrane. Membrane was slightly perforated. I extended the window, and below that, on the ramus side, I used a trapline burr to collect the autogenous bone. Using the harvested bone, I mixed it with the xenograft. I particulated it, and the ratio was 1:1. Bone graft was done as shown. Sinus membrane was partially perforated. Fibrin glue was used for repair. This is immediate post-op. This is 3.5 months later. You can see the sinus floor, and bone graft material was sufficiently grafted. This is 3.5 months later. This is 2 years after surgery. Graft material is gradually being resorbed and remodeling is occurring. This is after 6 years. You can see changes after 6 years, and such changes can also be observed after 10 years. If you look at the overall shape of the bone graft, it is maintained. When you mix with the xenograft, compared with when you mix allogenic bone with ramal bone, if you use xenograft, the decrease in bone volume is reduced, and the sinus pneumatization itself was smaller. Next, I'm going to compare the results between when autogenous bone and xenograft are used together and when xenograft is used only. In the same patient on the other side, I only used the xenograft. In 2006, the patient came in. On the left and right of upper posterior, teeth are missing. In the case of right, you can see distal free end. On the left side, the number 7 tooth exists in the most posterior area. CT was taken, sinus cavity. On the left side, there's a bit of mucosal thickening. Surgery was done on the right side first. The patient was 72-year-old male patient. The sinus membrane was lifted, and as mentioned, ramal bone was particulated and mixed with bovine bone for bone graft. After it was done, as you can see, perforation did not occur, but I used fibrin glue very frequently. This was 72-year-old patient. The graft material was fixed in the inferior side, and on the donor side, I used fibrin glue to manage bleeding. This is immediate post-op image. This is approximately a month and a half later. Surgery was done on the right, and now I had to do surgery on the left. The patient was 72 years old, and the patient was suffering too much. The patient complained that harvesting bone from the ramus side was too tough, although surgery itself was not much of a trouble. In the case of the other side, the most distal tooth was still remaining at the time. There were studies that it was okay to just use bovine bone, so I just decided to go ahead with bovine bone graft. On the left, because there was a most distal tooth, 2 implants were placed. The bovine bone graft was done. The final image on the right side, it's been approximately 2 years and 8 months. On the left, it's been 2 years and 4 months. This is after 10 years. Originally, sinus floor was here, and on top, a bone graft was done. In the case of the right side, autogenous bone and xenograft was used. Bovine bone was used with autogenous bone, and there was a bit of bone remodeling, but volume is maintained. Compared to that, in the case of left, although 10 years have passed, compared with the right side, there's still a little bit of radiopacity of bovine bone, but it does not affect the implant survival. Next, I'm going to talk about a case where autogenous bone was used with allogenic bone graft. I'm going to compare it with a case where allogenic bone and xenograft were used together in a layered manner. The patient came in 2008. As you can see in the upper right, number 6 is missing. I don't really use rainbow bone and alloplastic graft material together. I'm not sure whether you remember, but in 2000, Korea was swept in a controversy over mad cow disease. So the patients didn't like using bovine bone. I used alloplastic material on CT. The sinus cavity itself, on the left, there's a bit of mucosal thickening, but there's teeth remaining. The right side, it's clean. Lateral window was formed, membrane was lifted. From the ramus, ramal bone was harvested, particulation was done. Serosop, beta TCP was used together. Bone graft was done like this. This is immediate post-op, 1 month and a half later, and second surgery was done after 4 months. I did it quite quickly because there was distal tooth as I was doing follow-up. I didn't really mix alloplastic material, beta TCP, frequently. I thought the resorption occurred too quickly and there were tendency of radiopacity. Because there was distal tooth within 4 months, the secondary surgery was done. This is 6 years later, 5 years and 11 months later. Immediate post-op, you can see that ramal bone and alloplastic material were mixed significantly. But at 4 months, you can see significant resorption. After 5 years and 11 months, in the lower side of the implant body, even more than the apex side of the implant body, pneumatization occurred, and I don't really use ramal bone and alloplastic material together as I've done a couple of cases. I'm not really sure about histologic result, but clinically speaking, alloplastic materials seem to have limitation. The results came to be because I used a beta TCP. On the other side, it's 2014. At the time, I used allogenic bone and xenograft in a layered manner rather than mixing them. I do layered graft because allogenic bone leads to better bone formation. However, resorption does occur. In the case of bovine bone, resorption does not really occur and you can maintain the form. There are two different characteristics of these materials. If you mix them rather than having the material characteristics stay, mixing them led to deteriorated benefits. In the area where implant body is in contact with the sinus cavity or the host bone, I use the allogenic bone for better bone formation. On top of it, I use bovine bone so that the form can be maintained. I use it so that the graft material form can be maintained for longer term. There was no perforation, but the fibrin glue was used to complete the case. After surgery, on the top right side is 6 years and 8 months, and on the left is 8 months after. If you look at the x-ray, the right side, it's approximately 9 years later. As mentioned, if I use ramal bone with alloplastic material, You can see that bone is resorbed up to the apex side of the implanted body. On the left is approximately 3 years after. You can see the form of bone graft is maintained. In the inferior area, you can see the remodeling of bone graft material.
리모델링이 되지 않았나 하는 생각을 가지고 있습니다.
This is when I only used the allogenic bone. When you use only allogenic bone, this is very good for elderly patients. A lot of doctors do it this way. This is patient in 2010. This is sinus cavity and there's no clinical photo. Tooth number 28 on the left was removed and sinus graft was done using only allogenic bone graft. Surgery was done on the other side as well. Lateral window was formed. Allogenic bone was used for bone graft. On the mesial side, GBR was done because the bone width was narrow. On the very top, this is the image starting the surgery. On the right, this is 6 years, 10 months later. On the right side, allogenic bone was used. This is the same for the left side. A significant amount of sinus graft was done. In the case of left, this is 10 months later, and on the right is 9 months later. Significant resorption have occurred. If you look at the final panoramic image, it's been 6 years and 10 months, or 7 years. Compared to the initial amount of bone graft, you can see significant amount of resorption. Resorption occurred up to the apex side of the implant. I've used a lot of allogenic bone for bone graft, but if you use allogenic bone only, it may help with bone remodeling, but bone resorption can occur drastically.
전체적으로 흡수가 좀 많이 되지 않나 하는 생각을 좀 가지고 있습니다.
Next, most recently, when I do sinus graft, I use this technique as mentioned earlier. In the area where the implant is in contact with host bone, for better bone formation, I use allogenic bone, and on top of it, I use xenograft or bovine bone. I do layered graft to graft the sinus. Recently, the patients understand that autogenous bone is good. However, due to mobility of the donor site, people don't really like it. They feel it is quite painful. Therefore, I do not harvest autogenous bone. In 2012, the patient came in on both sides of posterior area. Teeth are missing. Lateral window was formed. Allogenic bone and xenograft was used. The ratio was approximately 1:1 as mentioned. In the area below, I've used allogenic bone, and on top, I used a xenograft. And this was how bone graft was done. On the other side, window was formed. In the same way, allogenic bone and xenograft is used for bone graft. The fibrin glue is used to complete the case. Second image is on the right is right after surgery. This is approximately 2 months later. Surgery was done on the other side. The final image is approximately 3 years and 10 months later. Immediate post-op. Compared with that, there's a little bit of bone resorption. I use allogenic graft below, and on top I use xenograft and have formed a dome shape. This has been approximately 4 years. Comparatively, within the sinus, the bone form is maintained. I've mentioned this earlier, but patients are now used to panoramic images. After doing bone graft, a couple of years later, they come back and some patients say, oh, the bone graft is all gone. In order to maintain the form, I use layered graft technique. I've been providing implant surgeries since 1995, so it's been 28 years. I did sinus graft using lateral approach, and I've used different graft materials. In 90s, I thought autogenous bone was the best, and in those cases, I used iliac bone. I did systemic anesthesia and took iliac bone graft from both sides, but the result was not satisfactory. There were many failures. So since 2000s, at around 2010, maybe up until early 2010, when I did lateral approach, I took autogenous bone from the ramus, and I tried different combinations with different bone materials. I used xenograft and allogenic material as well as alloplastic, but the results were comparatively okay. But patients suffered extremely when I harvested bone from the ramus. The surgery result itself was okay, but because of the pain in the donor site, since 2010, I did not really graft autogenous bone. I did not really harvest ramal bone because the patients didn't want it. I didn't do it unless I took a block bone graft. As of late, based on my clinical experience, I understand it would have been better if I provided more scientific evidence and histologic evidence, but based on my experience clinically, it is better to do layered graft technique using allogenic bone below and xenogenic bone on top. This would lead to better maintenance of the bone graft form and less problems with the implant. I used different combinations. This is my opinion on how to do bone graft when doing sinus lateral approach, and that's what I wanted to discuss with you today. This is not an absolute criteria. As of late, people say that it doesn't matter what kind of graft material you use for sinus graft. Please choose depending on your clinical situation. I hope my clinical cases helped you make your decisions. Thank you for watching.
시청해 주셔서 감사합니다.